Life is good. I keep busy doing just a ton of things. I find that there's not enough hours in the day to keep busy.
The one thing 93-year-old Grant Gunnell doesn't do is drive this motorcycle. But boy, does he love to ride it with his son.
I just enjoyed being with him and enjoyed the countryside and the fact that it gives me an opportunity to get out and do something new.
Grant felt inspired to try something new in his 90s after receiving a new lease on life.
He kept telling me, "You're gonna die, Grant, you're gonna die."
Grant felt fine, but in fact was suffering from aortic stenosis, a narrowing of the aortic valve that obstructs blood flow to the heart and the rest of the body.
That valve, when you think about what it does, it opens and closes 60 to 100 times a minute, each and every minute of your life. And in a certain percentage of patients, it wears out with age.
And because of Grant's age, he immediately qualified for the minimally invasive, low surgical risk transcatheter aortic valve replacement. The TAVR procedure meant no open heart surgery. Rather,
we enter the femoral artery, we come up through the aorta, we come through the bad valve, and on a wire, this valve is released from a catheter about the size of my pen into place. Actually, deploying the valve takes 15 to 20 seconds. Very safe and simple procedure.
Grant couldn't believe how simple it really was. Instead of spending weeks recovering from open heart surgery,
I played golf the next week. I really had no downtime at all.
So you can imagine Gordon's surprise when he received the same diagnosis as his dad, but a different treatment plan.
He said, "That's bad." And he said, "You're going to need open heart surgery." And I said, "Wait a minute. My dad didn't have open heart surgery."
Clearly, Gordon would rather hit the open road than have open heart surgery. As luck would have it, Brazo Arizona Heart Hospital is one of 87 in the world and the only one in Arizona participating in a clinical trial of the TAVR procedure for low-risk patients. And Gordon qualified.
I said it was my intention to ride my motorcycle to the hospital and then ride it home after the procedure.
While the doctor didn't allow for that, Gordon was home within a day and a half and back to feeling the wind in his face in no time at all.
I felt more alive. And I'm pretty sure that that's because I was getting more oxygen.
And like father, like son, both of the Gunnell guys have Dr. Timothy Byrne to thank for that.
It's been the most gratifying thing, really, of my career. Life-saving, life-giving, and life-changing.
And now more people will experience that gift of life with this minimally invasive approach. In August, the Food and Drug Administration approved the TAVR procedure for low-risk patients, making it available to another 1.5 million younger, healthier Americans.
The best thing about the valve therapy is that it gives patients both quality and it gives them life. And that is an amazing gift.
It's a gift this father-son duo relish on the ride.